Friends, my name is Muhammad Anwar. Today in this video, I am going to tell you about a technique to learn side effects of drugs using mnemonics. As you all know, side effects or adverse drug reactions of drugs are quite tricky in some cases. In most of the cases, it's a bit difficult to remember. The reason being, in some cases, it's quite unrelated with the exact pharmacology of the drugs. So today, I have selected 5 most important drugs and its adverse drug reaction that can be remembered using a technique called mnemonics. You just need to remember the drug's name to recall the adverse drug reaction of the same drug. Clear? So we are going to the first slide, that is adverse drug reaction of aspirin. Adverse drug reactions of aspirin. You just need to remember aspirin, ASPIRIN, adverse drug reactions of aspirin. So ASPIRIN, the first letter A for asthma. So the first adverse drug reaction of aspirin is asthma. As per the technique mnemonics, I am using aspirin as a mnemonics. A for asthma. And what is there for S? For S, it is salicylism. And what's there for P? For P, platelet disaggregation. And what's there for I? Intestinal blood loss. And for R, it is Ray's syndrome. And for I, idiosyncrasy or idiosyncratic reaction. And for N, noise, that is ringing in the ears. So by using the name aspirin, we have learned around 7 adverse drug reactions of aspirin. You just need to remember the drug name aspirin. A for asthma, S salicylism. With P you can remember platelet disaggregation. With I you can remember intestinal blood loss. With R you can remember Ray's syndrome. With I, idiosyncratic reaction. And with N, noise, ringing in the ears. The first adverse drug reaction, asthma, aspirin can cause asthma or breathing difficulties, and that is the reason why aspirin and other NSAIDs are contraindicated in asthma. You see the last one, N, noise, ringing in the ears. That's the most widely discussed adverse drug reactions of aspirin. It can cause, in some cases, it can cause ringing sound or ringing in the ears. That's a sound. So by using the name aspirin, we can recall the adverse drug reactions of aspirin. And let's see what's the second drug. It is morphine. And the ADR of morphine is morphine. That is, you need to remember morphine, MORPHINE. And what's coming for M? Meiosis. And what's there for R? Orthostatic hypotension, that is postural hypotension. And with R, you can remember respiratory depression, the most important adverse drug reaction of morphine, respiratory depression. And with P, pain suppression. With H, histamine release. And I, increased intracranial tension. And N, nausea. With E, you can remember euphoria. See, adverse drug reactions of morphine is morphine only, MORPHINE. M, meiosis or orthostatic hypotension, R, respiratory depression, P, pain suppression, H, histamine release, I, increased intracranial tension, N, nausea, E, euphoria. So it seems a simple method to remember the adverse drug reaction for your examination purpose. And the next, third drug, I have selected corticosteroids. It's a category. Corticosteroids is a category. It's not a single drug. And to remember the ADR of corticosteroids, you remember corticosteroid. CORTICOSTEROID. What's coming for C? Cushing's syndrome. What's for O? Osteoporosis. And with R, you can remember retardation of growth. With T, thin skin. And for I, immunosuppression. For C, cataracts or glaucoma. Again for O, edema. And for S, suppression of HPA axis, hypothalamic pituitary axis. with T teratogenic, and with E emotional disturbances, with R rise in blood pressure, with O obesity, and I increased hair growth, and D diabetes. So lots of side effects of corticosteroids can be remembered by using the name corticosteroid. CORTICOSTEROID, out of which osteoporosis, Cushing syndrome, immunosuppression, teratogenicity, obesity, diabetes, all are most widely discussed adverse drug reactions of corticosteroids. You just need to remember corticosteroid for your exam at the time of your examination, so that you can write corticosteroid and see Cushing syndrome or osteoporosis. In such a way, you can include around 10 or 11, 15 side effects of corticosteroids. How is it? Then the next drug, ADR of SSRI, selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitors, SSRI. ADR of SSRI is SSRI. What's there for S? Yes, serotonin syndrome, increased activity of serotonin. And for again with next S, you can remember stimulate CNS. And with R, reproductive dysfunction in male. Reproductive dysfunction in male, the most important side effect of adverse drug reactions of SSRI. And with I, you can remember insomnia, lack of sleep, insomnia. So adverse drug reactions of SSRI, by using the name SSRI, you can include for adverse drug reactions of SSRI. So the mnemonic we have used here is SSRI. Clear? And phenytoin, that's the last one I have selected for today's classes. Phenytoin. To remember adverse drug reactions of phenytoin, you write phenytoin, PHENYTOIN. What's coming for P? P for 50 interaction. Cytochrome P450 interaction. That's a microsomal enzyme. Cytochrome P450 is a microsomal enzyme, liver enzyme, metabolizing enzyme. Phenytoin is an enzyme inducer. It can induce cytochrome P450, so that the drug which is metabolized by cytochrome P450, its metabolism rate will be more and its duration of action will be less. So phenytoin is an enzyme inducer, and with P you can remember P450 interaction. With H, hirsutism, that is increased hair growth. With E, enlarged gum, that can be called as gum hypertrophy. In pharmacology textbook, you can see gum hypertrophy as the adverse drug reactions of phenytoin. That can be remembered by using the third letter E. Clear? And N, nystagmus. And with Y, yellow browning of skin, discoloration, yellow to brown or yellow browning of skin, color changes of the skin. Nystagmus means involuntary eye movements. Clear? And with T, teratogenicity. With O, osteomalacia, that is softening of bone due to deficiency of either calcium or vitamin D. And I, interference with vitamin B12 metabolism. And N, neuropathies like vertigo and ataxia. Vertigo, that is feeling of off balance. Ataxia means lack of muscle coordination. Clear? So by using the name phenytoin, you can recall the adverse drug reactions of phenytoin. P, cytochrome P450 interaction. H, hirsutism. E, enlarged gum. N, nystagmus. A, Y, yellow browning of skin. T, teratogenicity. O, osteomalacia. I, interference with vitamin B12 metabolism. N, neuropathies. So that's all for today's class. This video I am concluding here. And please subscribe my channel. Do subscribe my channel for more such informative videos. Please do share this video among your friends.